get started, I wanted to quickly talk about how I've been saving money lately. So the holiday season is always really rough for me financially, and I'm sure many people would agree. So I've been earning cash back using this free mobile app called Upside, who is sponsoring this video. Upside gives you real cash back on daily expenses like gas, groceries, and restaurants. So how Upside works is you download the app, you create an account, and then claim a cashback offer at a location near you. Then you shop as normal, make a purchase, and earn real cash back. The earnings are sent directly to your bank account, your PayPal, or a gift card. Millions of Americans love Upside, and frequent users earn an average of $340 a year. Upside is hassle-free, there are no points or complex reward systems, and it's available at over 50,000 businesses across all 50 states, from big businesses to local, so you can earn wherever you are. I find it really easy to use, and I love knowing that I'm earning money every time I'm shopping as normal. Over $50 million in cash back has been earned by its users, and it's personally already saved me so much money, especially on gas. You can get an extra 25 cents per gallon bonus on your first fill up just by using the Upside app when filling up my tank. I was able to get $2.56 per gallon and save $13 this month on gas. You can download the Upside app by clicking the link in my description and start saving on your everyday purchases. Viewers who sign up and redeem an offer will be automatically entered into a daily giveaway for the next 30 days for the chance to win a prize or $1,000. This is a limited time offer, so I highly recommend you check it out. So thank you so much, Upside, for sponsoring this video. And let's get right to it. Hello, my name is Dr. Lavender. I will be the physician performing your cranial nerve exam today. Before we get started, can I get your last name and date of birth? Okay, is that with an E? Perfect, and it looks like I'm in the right room. So I see that the nurse already took care of taking your vitals. You look really good there. I might check your lungs just to be really thorough. And before we begin, I have a couple questions to ask you, so go ahead and get comfortable. So, as you may know, a cranial nerve exam is one where I'm examining all of your senses. It's usually performed after an injury, or if we suspect that the patient has had a traumatic brain injury, things of that sort. So, my first question is, are there any areas of concern? Have you experienced any changes in your senses? Like changes in your sight, taste, smell, hearing, sensation? Okay. So I know to focus on that. Okay, can you go into it a little more detail? Okay, so I will definitely be extremely thorough with that. Have you had any injuries, any surgeries lately? Okay. And that was a couple months ago? Okay. And that was inpatient? Okay. Do you remember the physician's name who performed that surgery? Okay. Dr. Richardson. He is also at our hospital, so I do know him. Excellent. Okay. Do you have any scars? Any sizable scars? Okay. There. Alright, I'll take a look at that. Scars can affect sensation, so when I'm performing tests to the sense of your skin, the sensation of touch on your face, you might notice a difference there. Alright, so let me just make a note of that, because it's not necessarily an indication of a problem or any issues with your brain or anything like that. It's more the sensation of a scar can change how you feel, if that makes sense. It's usually a little number. Okay. Well, thank you. Anything you would like to ask me or tell me before we begin? Perfect. Okay. Well, then let's get started. Alright, let me just sanitize and put some gloves on before we begin. How's your day going so far? Okay, could be better. I'm sorry to hear that. Hopefully this exam will be pretty relaxing. No need to be anxious or stressed. We have no reason to suspect that anything will be wrong. And if we find something of concern, we'll work together on next steps, okay? Okay. So let's just get these gloves on. My day, it's going well. Thank you. You're actually my first patient of the day. I took the morning off because my kids had a school play that I went and saw. I don't know if you've seen an elementary school play before, but it's very sweet, it's very endearing. The kids are all so nervous but having fun at the same time, trying to remember their little lines. It was very nice. Okay. So go ahead and straighten up for me and scoot to the edge of the table. Good. Okay, just your legs hanging over exactly like that. Okay, so let's go ahead and take a deep breath together. I like doing that with my patients because a lot of my patients find the doctor's office a little nerve-wracking, so we want you to just be comfortable. Alright, so the first thing we're going to test is field of vision, eye movement, things like that. So go ahead and stare at my nose. Okay. Now, on the edge of your vision, I'm going to wiggle my fingers like this. And I want you to raise your hand and point at which finger I'm moving. Exactly, without breaking eye contact or staring at my nose, whichever you prefer. Okay. Alright, so just look at me. Ready? Good. 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 Exactly. Okay. Now I'm going to come around from behind you and wiggle my fingers, and when you see my fingers enter your field of view, let me know. And just keep your head still. Keep staring at my face, okay? Good. 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 Alright, excellent. So now I'm gonna just rest my hand on your face. Can you keep your head still and just follow my fingers with your eyes? Good. Now this side. Alright, excellent. Now I'm gonna hold a finger here and step back a little. I want you to rotate between staring at my finger and staring at my face. Ready? Okay. Stare at my finger. Stare at my face. Stare at my finger. Stare at my face. And stare at my finger. Good. Okay, now I want you to keep your head still and just follow my fingers with your eyes. Again, do not move your head. Okay, good. Perfect. Did you experience any pain, any discomfort while you were moving your eyes around? Alright, if I have permission to touch you, I'm just gonna touch around your eye socket. Make sure that you are not experiencing any pain. Can you go ahead and close your eyes? I'm gonna very lightly touch right above your eye. me. Good, okay. Do you wear glasses or contacts normally? Okay, excellent. Okay, now I'm going to look in your eyes with the light. It doesn't look like your pupils are dilated necessarily, so I think that won't really be an area of concern, especially because they're the same size, but go ahead and stare at my shoulder here. Bright light. Okay, looks good. Let me just... Okay, now stare at the shoulder. Sorry, yes, I am very close to your face. Alright, everything looks good. No redness, irritation, swelling. Good. Okay, now I'm gonna do the swinging light test, and that's just to make sure that your pupils react in both eyes exactly the same. Sometimes it's a sign of a concussion or injury to the head when you shine a light in one eye, one pupil dilates and the other stays the same. We want them to both react at the same time, okay? So go ahead and stare at me. Okay, they are reacting beautifully. No sign of issues there. Good, okay. Let me just test one more time the eye movement. Can you follow the light with your eyes? Good. Excellent. Okay. And before I forget, I did want to check your lungs. So I'm going to just lay this over your shirt. Can you go ahead and take a deep breath for me? Again. Good, and I'm going to lift up your shirt just a little and place it on your belly. It is a little bit cold. Alright, deep breath. Alright, let me just listen for a second. Alright, and then on your back, deep breath. Good. Deep breath over here. Good, okay. Now that isn't necessarily part of a cranial nerve exam, but you did mention you've been feeling a little out of breath lately. So I just wanted to check if I hear anything in your lungs or anything like that, but I do not, so it looks good there. You are a non-smoker, correct? Any vaping, smoking, anything like that? Okay, alright, good. Now I'm just gonna have you open your mouth. Good, just taking a look. There. Looks good. Okay, any changes to taste or anything like that? Alright, then let me change this bit here. Now we're gonna look in your nose. I'm just gonna lift your nose some. Looks good. Any changes to your sense of smell? Okay, well, I'll go ahead and test your smell then. It looks good to me here, but let's go ahead and just make sure that's operating as it should. Okay, so I have two scents here. Can you go ahead and close your eyes? Close your eyes. And I'm going to hold up the first scent. Can you close one nostril? Exactly with your thumb, and I'm gonna hold it up. Go ahead and take a deep smell. or anything like that? Okay. So I encourage all of my patients who use Q-tips in their ears to never actually enter their ears with the Q-tip. Just go around the outside. Exactly. Yeah, we don't want to insert anything into your ear. You have a risk of hurting your eardrum, and the ears are actually self-cleaning, so if you just want to clean your ears, just go around the hole like this with the Q-tip, and that's sufficient. Okay, so I'm going to grab a new tip here. Okay. And you can have your eyes open now, so I'm just going to pull back on your ear a little bit and look in the ear. It looks good. You take very good care of your ears. Good job. I'm not seeing any inflammation, redness, or impacted wax. So we won't be needing to do an ear cleaning on this ear at least. Alright, now I'm going to pull back on your ear on this side and take a look. Same thing here. I know it's a teeny bit uncomfortable. Okay, that looks good. Alright, now I'm just gonna palpate the ears a little. Tell me if you feel any discomfort at all. It's good, okay. And then just here, no discomfort. When I pull slightly here, it's good. Okay. Let me just check behind. Check behind here. No pain, right? Good, okay. So you said no changes to hearing. Perfect. Alright, so I'm gonna make a quiet sound. Tell me which ear you hear it in. You can point or say left or right. Good. 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 Good, okay. Now I'm going to make a louder sound like this. And I'm going to whisper a word in the ear. I'm going to have you close your eyes. And I want you to tell me what word you hear. Okay? Blue. Blue, good. Violet. Violet, good. Okay. Well, that is all looking excellent now. So we've covered your nose, ears, eyes, and mouth. So now we're going to start to test sensation in your body and your reflexes and your movement. But first, I just want to check your sinuses. I already checked your tear ducts, so I'm just going to check your face here. Your sinuses, your lymph nodes. Your lymph nodes being swollen is usually a sign that your body is fighting something off. You're in your neck. Can you look up? Good. Behind your ears and your neck. Are you allergic to anything? The nurse should have asked you. Okay, good. Okay, you told her you're allergic to bees. Alright, have you ever been stung by a bee? Okay. Alright, that sounds like a classic reaction. You have an EpiPen, correct? I highly encourage you to keep that in your car or your purse or on your person at all times. Okay, good job. I know they're expensive. this tool here that has a harder end and a softer end. I'm going to touch either the soft end or the hard end to your face. Tell me if you feel soft or hard. And as an example, that's what soft feels like. That's what hard feels like. Ready? Okay, close your eyes. Good. 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 Perfect. Now I'm going to touch your face in a mirrored pattern, and I want you to tell me if you feel the exact same sensation on both sides. So this should feel the same on both sides. Okay? Okay, so there it feels a little numb. I think that's due to the scar that you have there. Let me touch it again. Okay, slightly less of a sensation there. Alright, I will note that. Okay, same. Same. Okay. Good, okay. So let me just check here again. Okay, so slightly left here, like I said, because you have a scar there. That's the most logical explanation for why there's a little less sensation there. But I will add that to my notes. You still feel this though. What percent do you feel this side versus this side? Like 100 to 80, okay. Good. Alright. Okay, so I have this metal tool here that I'm going to use to press to your face. It's made of metal and it's quite cold. Not uncomfortably cold, just cool. I want you to tell me that if you feel the sensation of cool when I lay it on your face, and if it feels pretty similar on both sides, okay? So starting here. Okay. Then down here on your cheek. Okay. On the other cheek. On the left side of your chin. The right, well, my right. Good. The side of your nose. And this side of your nose. Excellent. Okay, I'm going to change gloves for a fresh pair. Okay, I do like to change my gloves at least once during exams like this because I do find myself touching a variety of tools. So we just want to stay as sanitary as possible. Alright, so go ahead and relax your face for me. Good, now smile. Good, can you frown for me? Raise your eyebrows. Okay, good. Now close your mouth and puff out your cheeks. Alright, I'm going to press here. Don't let me press the air out of your mouth, okay? So. Good. Okay, now raise your eyebrows again and don't let me push down on your eyebrows. Good. close your eyes really tight and don't let me open them. Good, okay. Now let me just check here. Okay, good. Now show me your teeth. Stick out your tongue. Good, everything is looking excellent there. Now we're going to move down to your shoulders. Can you raise your shoulders up and don't let me push them down? Perfect. Now can you look up and hold it? Now look down and rotate your head to both sides like this. Good. Now look that way. I'm just going to push your face slightly to make sure that you can resist that. So don't let me move you. Good. Now look that way. Good. Everything's looking good there. Okay, so now I want you to hold my hands and squeeze as hard as you can. Good. Okay, now take your hands like this. Make an OK symbol. And tap here on your thumb knuckle. And then at the tip of your thumb. Good. Now I want you to take your fist like this, and with your other hand, do this rapidly. Whichever hand first. Okay, other hand, exact same thing. Okay, now hold your arms out like this, and don't let me push down. Good, okay. Keep them out, don't let me push up. Good. Alright, everything's looking good there. Okay, so now I want you to hold both hands out and then touch your fingers to your nose, left or right when I tell you, but I want you to stare at my face, okay? So you're gonna have your hands out like this, touch your nose while staring at me. Okay, so hands out, good. Now left hand to nose. Good, okay, keep staring at me. Right hand to nose. Left hand to nose. Right hand to nose. Good, okay. Now, I'm going to use this reflex tester and just relax. Good, I'm going to tap on your arm. Good. Good, one more time. Good. Alright, now down here at your knee. Good. Just relax. Perfect. Good, okay. Okay, so now I need you to spread your fingers out in front of you like this. And don't let me close your fingers. Good. Okay. Now hold your arms up like this and don't let me push them towards your face. Okay. Good. Okay, now hold your hands out like this. I'm just going to push down. Don't let me move them. Okay. And hold your hands out like this again and don't let me bend your wrist. Good. Alright, so now I want you to look over here at the sign. I'm going to tap on your forehead. Don't blink when I tap on your forehead. So stare over here. Good. Continue staring there. noticed that numbness affecting you, affecting your life in any way, I think it might just be due to the scar there. Over years, it might go away, but it might not. That's just kind of a result of having a large scar there. When you move your eyebrows up and down or make any facial expressions, do you find that that makes it difficult to do that? It's too tight or something like that? No? Okay. Excellent. Let me just tap one more time on this side and this time. And I want you to reaffirm that this is about 100% and this is 80, okay? Yes, okay. Well, I will send you a report through the portal online once I analyze everything that I've done today, and if I feel like you need to come back in and we can reassess this area right here, we can do that. Okay, perfect. Well, thank you so much for coming in today. You passed with flying colors. Do you have any questions for me? Okay. If you think of any, you can send me a message through the portal. Exactly. Okay. Well, everything was great. Your sight, your hearing, everything. So if anything changes, if you think of a question, I am